Hello my people, welcome back to our educational channel, and for the better part of this week we have been discussing about fibroids. We discussed about intramural fibroids, and now we are ending our second discussion about subserosal fibroids. Before we continue, let me start by thanking you people for the continued support that you are showing me. Thank you for the subscriptions, thank you for the comments, thank you for the likes, and it's my prayer that you may continue sharing our videos so that they may reach as many people as possible. So continue keeping the support on. So let's get back to our topic of discussion, whereby we were discussing about the available treatment modalities for this subserosal type of fibroid. And today we are going to talk about ultrasound guided radiofrequency ablation and also magnetic resonance guided focused ultrasound. Those are the topics we are going to deal with today. So let's start by ultrasound guided radiofrequency ablation. Here, a high wave energy waves are used to generate heat that destroys the fibroids. So this kind of treatment usually depends on heat, whereby a high energy wave are used to generate heat, and this heat destroys the fibroids. Note this: the correct placement of the radiofrequency device within each fibroid is located and verified by ultrasound before ablation is performed. I hope you get that point. The correct placement of the radiofrequency device, the device that produces the heat that destroys the fibroid. So the correct placement of this device is located and verified by ultrasound before this ablation is performed. This procedure is considered safe and performed on an outpatient basis. This means you don't need to be admitted in an hospital setup for you to get this kind of treatment. So let's get to magnetic resonance guided focused ultrasound, or what we call MRGFUS, magnetic resonance guided focused ultrasound. This is a relatively new non-invasive procedure. Non-invasive means there is no need of any incision in this kind of treatment method. We discussed about so many methods whereby surgery is involved, and where there is surgery, it means that the procedure is invasive. So here there is no any kind of surgery needed. So in magnetic resonance guided focused ultrasound, which is a relatively new non-invasive procedure that takes about 3 hours to complete. So it takes about 3 hours to complete. Patient or the person having the fibroids lies in a magnetic resonance images or MRI machine, where a radiologist uses to identify and target the fibroid So when the patient lies on a magnetic resonance or MRI machine bed, a radiologist uses the MRI to identify and target the frequency. After targeting the fibroid, a high intensity ultrasound waves are then used while the person is on the MRI to eat and destroy the fibroid. So this also depends on it to destroy the fibroids. Note this: magnetic resonance guided focused ultrasound has a low risk of complications and short recovery time, as long as it's not invasive or it doesn't involve any kind of surgery. Obviously, it needs a short duration for a person or the patient to recover. What are the limitations or the disadvantages of using magnetic resonance guided focused ultrasound? One, there is lack of long-term studies. No long-term studies about this kind of treatment. Number two, lack of studies on effects. There is lack of studies on effects on fertility and pregnancy. This means no studies showing the effects of using this kind of high frequency heat waves on pregnancy and fertility. No studies showing that it can affect one's fertility. No studies showing that it can affect one's pregnancy. Number three, it cannot treat all types of fibroids. It cannot treat all types of fibroids. So, the next point, it cannot treat fibroids that are located near the bowel and bladder. All are outside the imaging area. This simply means it can only deal with fibroids that are located within the imaging area. Number five, or the fifth disadvantage or limitation, it requires extensive period of time involving MRI equipment. So what will happen in an area where we have no MRI equipment? What will happen? So in this point, it requires extensive period of time involving MRI equipment. It takes a lot of time because the radiologist has to target the fibroid with the ultrasound waves and destroy them. The next point, the next disadvantage is that it's not covered by many insurance companies which consider this procedure as investigational, experimental, and unproven. So many insurance companies don't cover this kind of procedure or magnetic resonance guided focused ultrasound because they believe it's investigational, experimental, and unproven. This marks the end of our first video today. So let's meet in the next video, whereby we will continue with the discussion on fibroids. So guys, thank you for the support. Let's continue subscribing, liking, and sharing our videos, and also commenting. If you have a topic you want us to discuss, you can put it in the comment section and we'll be able to tackle them. So let's meet in the next video.